So let's start with the Klebsiella family, and the tribe Klebsiella is going to include a lot of things, but the most important one for us are Klebsiella and Serratia. Now, when I'm talking about Klebsiella, there are different types of this Klebsiella, which is the most famous one that is known as Klebsiella pneumoniae or the Friedlander's bacillus. Friedlander's bacillus. In fact, if you say Klebsiella pneumoniae, it has many subtypes going forward. It has a subtype called as pneumonia itself, Ozyne, and rhinoscleromatis. So Klebsiella pneumoniae, Klebsiella pneumonia ozyne, Klebsiella pneumoniae, rhinoscleromatis. So when I say Klebsiella pneumoniae, that is the one which is obviously going to cause pneumonia. There's no doubt about it. So first let me tell you what all does this Klebsiella pneumoniae cause. It causes pneumonia, which can be community acquired pneumonia, hospital acquired pneumonia, ventilator acquired pneumonia. So CAP, HAP, VAP. Community acquired pneumonia, hospital acquired pneumonia, ventilator acquired pneumonia. Also, this can cause exacerbations in COPD patients. This can cause CAUTI. What is CAUTI? Catheter associated UTI. And it can cause septicemia. So primarily, of course, it's pneumonia, but it can cause a lot of other things also associated with it. That was Klebsiella pneumoniae, pneumonia of Friedlander's bacillus. Now we come to Klebsiella ozyne, and ozyne for obvious reasons is going to cause a disease called ozyne only, and ozyne is nothing but atrophic rhinitis. That is what is going to happen in ozyne, and this is very, very interesting because in this the patient has a foul smelling discharge, which means that a person around him or her will be able to smell that discharge, but this patient himself or herself has anosmia. Anosmia means that the patient will not have any smell ability, but imagine this is known as merciful anosmia, which means that himself or herself, he can't smell anything, but everyone around him is getting a very bad smell. That is what is Klebsiella ozyne. Next, what we have is Klebsiella rhinoscleromatis, which obviously causes rhinoscleroma. And rhinoscleroma is something which is associated with three very important pictures. So what is the gross finding and what is the microscopic finding of rhinoscleroma? We'll see that with the help of a diagram. So look at this, guys. This is Klebsiella rhinoscleromatis or rhinoscleroma. Please, in the exam when you go, don't confuse this with something else that is known as rhinosporidiosis. Rhinosporidiosis was totally different. I had studied that under the fungus wala chapter, totally different. Here I'm talking about rhinoscleroma, and that shows you this kind of a nose. Can you see? Initially there's a woody nose, so that is how you describe it. It's woody, but after some time the entire nasal cartilage, it goes back, the soft palate, everything is destroyed. So you can call it a woody nose, or you can also call it the Hebra nose. That is rhino. Rhino will anyway tell you that wood hai na, matlab nose hai. So woody nose or Hebra nose is there. What do you see microscopically? We see something called mucoid cells. So if you look at the first picture over here, all these foamy cells. All these foamy, what are these? Macrophages which have eaten up the organism. So these foamy cells are referred to as the mucoid cells. And if you look carefully, dekho, it's a bacteria. It is going to result in antibody production. Antibody production means these pink color bodies that you're getting. Immunoglobulin, that is Russell body. Where in pathology do you study Russell body? Antibody disorder, multiple myeloma also shows you. So coming all the way back, now I think you all know that grossly it is going to show you either you call it a woody nose or you call it a Hebra nose. And next, microscopically, it shows you two things. One cell, which is very, very famous, is going to be the mucoid cell, and the other one is going to be the Russell bodies. Now, this was about Klebsiella pneumoniae and its subtypes. We have something called Klebsiella granulomatis, which is very important because this causes something called genital ulcers. And those genital ulcers are painless. Now we started on that journey. We are going to do a lot of genital ulcers on the way. I'll keep telling you which are painful, painless. For the time being, please remember Klebsiella. So repeating once again, I am saying for the time being, Klebsiella granulomatis. So dekho, Klebsiella, and we are saying granulomatis. So this is how I have learnt it. That G will remind me that it is going to be a genital ulcer, and I have already told you that illa means no. So there is going to be no pain in this genital ulcer. That is Klebsiella granulomatis, also known as also known as donovenosis. Donovenosis means that this is going to show you the donovan bodies. What are donovan bodies? So you can very well see over here that there is a big cell which we call as the Punt cell. Punt cell is nothing but a macrophage. There will always be a foodie macrophage which has eaten up everything, isn't it? So there's a really big cell which is said to be a macrophage, and that macrophage has these organisms which are showing you the very, very famous safety pin appearance. Guys, I'm going to give you a list in a while. Safety pin appearance basically means that there is bipolar staining that is present. Whenever we say safety pin appearance, in simple words, that means that there is a bipolar staining that is noted over there. So this is just one of the organisms. Klebsiella granulomatis, I'll repeat it. Klebsiella, illa means no pain. G, granulomatis means genital ulcers, also known as donovenosis. So it is going to show you the donovan bodies. What are the donovan bodies? The donovan bodies are nothing but this Punt cells, and what are inside these Punt cells? These Punt cells contain the famous safety pin appearance. So this wraps up definitely this entire thing for all of us, and we can move forward. So recently there is a strain which is known as the hyperviscous and hypervirulent. So HVKP means what? HV means hyperviscous, and virulent, another V means hypervirulent strain which has come up of Klebsiella pneumoniae, so known as HVKP, hyperviscous, hypervirulent strain of Klebsiella pneumoniae. And that is, of course, the name is only telling you that it is very, very virulent. So it is going to cause a lot of things. It's going to cause not only community-acquired pneumonia, but also meningitis, also sepsis, and all the more it's virulent. It's very resistant to treatment. So just another new strain, hyperviscous, hypervirulent, very, very virulent, very, very resistant. Now let's come back, guys, and talk about the different, what did I say? Hyperviscous. You will say, ma'am, if you're saying hyperviscous, is it viscous in general? Exactly. That is what I want to come down to next. What exactly is its morphology and its testings? So please note that K for Klebsiella, and you need to know that Klebsiella K wala sound na. So this means it is a capsulated organism. Yes, Klebsiella, Ella tells you it is not motile, Ella is no motility. And Klebsiella tells you it is a capsule made up of mucopolysaccharides. So now, because of that capsule, is there something that you're going to find out? Let's see. So tell me, on a MacConkey agar, is it a lactose fermenter? Yes, E. coli, Klebsiella, they are lactose fermenters. But did you also notice that MacConkey mein what color do we get for lactose fermentation? You get a pretty pink color. So now if I ask you, E. coli is also going to be a lactose fermenter and is going to give you a pink color. And Klebsiella is also a lactose fermenter and is going to give you a pink color. How will you differentiate? So you will say Klebsiella has a capsule. Anything that has a capsule will not only give you a pink colony, but will also give you a mucoid colony, not just a pink colony, also a mucoid colony. So have a look at this. These are your MacConkey agar. Of course, it has come out to be pink. Anything pink definitely tells me that it is definitely a lactose fermentation. But look at the shine on its surface. It's very, very shiny. It's mucoid. Similarly, look at the shine over here. And if you see, not only is it mucoid, so the shine is telling me it's mucoid, but if you try to pick it up, can you see with the loop it's showing you a string, right? So this is going to show you the stringy appearance, which is very, very important. So please note, not only is it mucoid, but they have started calling it the string test. It also shows you string test positivity. Talking about its enzymatic activity, let me know. There are very few. Let me tell you, just Proteus and Klebsiella. I'll give you a mnemonic in the end. These are urease positive organisms. So can you tell me all the urease positive organisms for urease? You are going to first get a punch, and after that you're going to get a kiss. Okay, so what is happening in urease? You are going to get a punch, and followed by a punch, you will get a kiss. So the mnemonic for urease is punch kiss. What is punch kiss? Let's get going. P for, like I told you, Proteus. The Proteus ends with us, so urease. Then U for urea plasma, common sense. N for nocardia. C for cryptococcus, again has urease, US in the end. Then we have H for Helicobacter, Helicobacter pylori. All of us know for Helicobacter pylori in the stomach we have that urea breath test and all. Hai na? Then we have the one that we are doing, Klebsiella, and then we have these two staph, Staph saprophyticus and Staph epidermidis. What family were they belonging to? They were coagulase negative staph. Hai na? So repeating, guys, what is punch kiss? Let's do a repeat. P for Proteus, because it has a US in the end. Urea plasma anyway has urea in its name. Nocardia. Cryptococcus, US in the end. Helicobacter everyone knows. Klebsiella, and the corns wala staph epidermidis and saprophyticus, these are all the urease positive organisms. So yes, Klebsiella is definitely going to be urease positive. What about its IMVIC testing? This I've already told you, minus, minus, plus, plus. Because now again, if you have to differentiate between E. coli versus Klebsiella, I have told you the IMVIC testing. E. coli was plus, plus, minus, minus, and Klebsiella was minus, minus, plus, plus. Finally, coming to the fermentation, it ferments all the sugars with acid and gas. So all of these biochemical reactions are sorted. So simple. अगर ऐसा stringy test दिया, that is Klebsiella. अगर ऐसा pink color का test दिया, that is going to be urease positive. So you are punch kiss, and of course whether you get a punch, you're going to have a red cheek, pink cheek, or if you get a kiss, then also you're going to blush by being red. So red or pink, so urease is going to give you a pink color. So pink color ka hi colonies on lactose, pink color ka hi urease positivity is what you get. What is the treatment? They are not very easy to treat because we have a lot of XDR strains, drug resistance that is there. But yes, for even because of that, we use advanced antibiotics like piperacillin and tazobactam. We can even fight those XDR strains with colistin and polymyxin and others, but they are very expensive. So all in all, I realize you have to rely on the antibiotic sensitivity testing. If I want to summarize this entire Klebsiella, first I can say Klebsiella K for it had a capsule. Then I told you that it is also going to be lactose fermenter, and it's going to have a very important enzyme called urease. And I told you lactose fermentation on McConkey gives you pink color, and urease test is also going to give you a pink color. Remember, punch and kiss, whether you get a punch you turn pink, whether you get a kiss you turn pink. So both of them are going to give you a pink color. Then finally I told you have illa. Illa will tell you that, oh, it is not motile. This is a non-motile organism. Just a quick summary. This was